All right, well, first and foremost, I want to thank everybody for attending, whether it's in person or joining us via Zoom for our collaboration coordination convening. All right, to jump right in, we do have a pretty lofty agenda for 2 hours. So first, we're going to do some welcomes, and I'll go over the objectives for today's meeting. Then I'll move into some highlights of our current work here at the Health Council. And then we're going to move into a large group activity, so essentially a community roundtable. Afterwards, you'll have about a 10-minute break where you can use this time to do some informal networking, use the restroom, or just take a second to sit. Then we will move into a small group activity and then do some reflections, and then I will close this out. All right, so our objectives for today is to deepen our understanding of each organization's work while we gather meaningful input to inform our Health Council strategic plans. We also want to highlight the strengths of member organizations and strategies, as well as strengthen connections between local agencies and organizations. But before I get into this, let's do some quick introductions, so we know who all is in the room before we get into our large group activity. So I'll go ahead and kick us off, and then I'll choose people from the Zoom, and then we'll pass it over to the in-person. So I am Kayla Blanchard. I am the Health Equity Specialist and Coordinator for the Otero County Community Health Council, and I'm going to pass it on over to Lisa.
Hi, everyone. I'm Lisa Skutnik. Can you hear me okay? Sorry, it gets too loud in the morning. Sorry, I'm Lisa Skutnik. I'm the president of the Otero Health Council. It's nice to meet everyone virtually. Thanks for coming. I'm going to pass it over to Alfred Tyler.
Hello, my name is Tyler Allred. I am the Business Development Representative for Las Cruces Recovery Center, and I am so happy to be here. Thank you for having me. Denise?
Hi, I'm Denise Flores. I'm the EFMP Exceptional Family Member Coordinator at Holloman Air Force Base.
All right, let's go to Carmen Gloria.
Hola, buenos días. My name is Carmen Gloria Halsey. I work for the UNM Comprehensive Cancer Center, the Office of Community Outreach and Engagement. And what about Tracy Rivera?
Hang on. Hi, I'm Tracy Rivera. I work for the Mobile Crisis Response Team as a peer support specialist. I'm also a member of the Otero County Community Health Council, and I work with the care team. And I need to see who I can send this to. My views. I am going to send it to Liz.
Morning, everyone. I'm Liz Olivares. I'm the Southern New Mexico Senior Program Manager for Presbyterian Healthcare Services. I am with the Regional Community Health Department overseeing programs in Lincoln County, Otero County, and Doña Ana counties, and I reside in Las Cruces. Thank you for having me. I will pass it on to Holly.
Hi, good morning, everyone. I'm Holly Mata. I'm a Health Council member. I teach part-time public health sciences at NMSU, and I support the family medicine residency program here in Alamogordo as their community health faculty. And I'll pass it to Rainey.
Hi, everybody. I'm Rainey Richardson, and I am a Health Council Support Specialist, and wonderful to see you all. Crikey. Did Liz already go?
Yes, but Renee hasn't.
Brittany.
All right, let's pass it over to Denise Williams.
Good morning. My name is Denise Williams. For some reason, my camera's not working. I'm not quite sure what's going on. I am the community liaison with the Health Council and the LC12 coordinator.
Okay, and let's pass it over to Jeanette.
Good morning, everyone. Jeanette Barunda. I am the OCCHC Vice President and also run the Mobile Crisis Response Team in Alamogordo. My camera is still not working on Zoom, so I am here, but you just can't see me.
All right, and now let's pass it over to Tanya. I hope I pronounced your name right.
Hey, it's pronounced Tanya. That's okay. Everybody pronounces it wrong. I'm Tanya, and I am the Assistant Manager and Marketing Director at Golden Hearts Home Care and Diagnostics.
Awesome, thank you, everybody. Now, everybody in person, would you mind introducing yourselves?
Good morning, I'm Kim Richards. I'm the CEO of the Counseling Center, and we are the fiscal agent for Health Council.
Amy Barella, Otero County Commissioner. Good morning, Becca Soratis from Presbyterian Outreach Team. Hi, I'm Lisa Yale, also with 100% Otero. Nice to see everybody. Hi, everyone. I'm Maureen with New Mexico Department of Health, and I'm the Health Promotion Specialist here in Otero County. Are y'all hearing us okay? Yes, okay, I see him.
I'm Leticia Chavez. I'm with Presbyterian Medical Services. I oversee several places here in Lincoln and in Otero County as well as Lincoln County.
Candace Helmick. I'm also with Presbyterian Medical Services, and I assist our Southern Region Director.
Oh, yes. Hello, I'm a little tardy. John Kutnak. I'm with the Mexico Department of Health. I'm the Southwest Region Health Promotion Program Manager.
Thank you for joining us. You get a pass because you have the privilege to come. Well, we did have one person who came from today. We have a few more folks coming in the room. People who want to. Hi, welcome.
Hi, my name is April Stickles, and I am with Christus Health.
You want to let them know?
Oh, sure. Hi, I'm Raquel Labney. I'm the school liaison from Habanero Business.
And we have one more person just signing in.
Oh, Christine, I'm sorry. I'm Christine Zinker. I'm an early childhood solution coordinator with 100% Otero.
Awesome, thank you, everybody. All right, so now we're going to move into some Health Council updates. But before we do that, I want to ground us in who we are as an organization. So we as an organization envision Otero County to be a place where all people have a fair and just opportunity to be as healthy as possible. Now, in order to achieve that vision, we promote programs, practices, and policies that advance health equity in Otero County. So that's going to look a lot different depending on the population that you're interacting with, and that's why we do so many different things. We have been active since 1996, and we strive to assess, promote, and enhance the health and well-being of county residents by encouraging and supporting broad-based community involvement. We partner with the Otero Behavioral Health Collaborative to prioritize our focus areas, which are strengthening mental and behavioral health support, reducing substance-related harm, promoting civic engagement, and advancing health equity. So we have a couple of action teams and partnerships that are in motion. So for our first action team, CARE, I'm going to pass it over to Tracy to share a little bit about her team and some of the things that they've been working on.
Okay, well, the CARE team is an acronym that stands for Community Awareness, Resilience, and Engagement. And our focus is on improving outcomes for children and youth and families facing behavioral health challenges through education, outreach, and engagement. One of the things that we do is try to support the other action team, like with HEAT or what we can do with the Health Council. Right now, we are, my last meeting, Christine from the Children's Coalition came in and gave us a talk, and our new one that's coming up on the 18th, and we meet at 8:15 on Teams. We're going to be having, Jordan from Kids Inc. to go over what they do and how they affect the community. Right now, I've been working mostly with speakers and trying to work in encouraging other people to come in for us to do some more projects and maybe work with Kayla and Lisa to see how we can promote different strategies. One of the things that we're thinking about is trying to partner with Otero Arts for the summer because they do a lot of engagement with children with art projects. Thank you.
Awesome. Thank you, Tracy. Next, I'll go over the HEAT team, which stands for Health Equity Action Team. We promote civic engagement and health equity through community organizing. So some of our recent accomplishments include hosting bi-monthly health equity discussions. In fact, we just had one this past Tuesday where we had a presentation about the closed loop referral system and the Food is Medicine initiative. Previous topics included the housing issues, topics like intersectionality, vaccine efficacy and equity, and things of that nature. We also train individuals and agencies on Vote ER and civic health, just to educate others on the link between voting and our health. Right now, our team is focusing on conducting focus groups with housing and transportation advocacy groups so that we can develop a housing and transportation issue brief, which I will talk about a little bit more in depth when we get to our community health improvement plan in the subsequent slides. Now I'll pass it over to Denise to go over LC12.
Thank you, Kayla. So the LC12, that's the local collaborative between Lincoln County and Otero County. And the primary goal is to engage the community regarding local needs and gaps, and to host outreach events to get more membership, more engagement from the community as far as areas that we need to help them when it comes to the behavioral health part of it. We've co-hosted and attended the suicide awareness walk. We went to the health fair. We co-hosted a QPR training. At the beginning of the year, we also were fortunate enough to meet with the county commissioners and give the county commissioners a brief rundown of what the Health Council and LC12 does for the community. We hold monthly meetings on Tuesdays, the second Tuesday of the month. And I worked with Kayla and Rainey to help work on building a website. The next 6 months, we plan on hosting monthly just LC12 meetings in addition to the BHC meetings. We're going to host hopefully 2 more events and do some more trainings. And that's just a brief rundown of what LC12 does. And we work, like I said, closely with Lincoln County. Thank you.
Awesome. Thank you, Denise. All right, so besides just coordinating Health Council operations, the 2 big projects that we focused on this past year were the New Mexico Department of Health contract and the Community Health Improvement Plan, aka the CHIP. So the next couple of slides are just a breakdown of what was involved with this DOH contract. So the first column is just a description of the tasks. The middle column are the deliverables that we had to meet. And then the last column is our status. So we had to update our action plan and implement that for our CHIP. We also had to provide reports on our coordination and implementation of various initiatives. So here in this middle column, these were the initiatives that we selected. We selected to coordinate health promotion activities that aim to increase the number of individuals who were accessing services and treatment at our public health offices and their services. We also coordinated and promoted DOH mobile unit visits to our community. We wanted to promote healthy lifestyles that are free from tobacco misuse and addiction, as well as promote and coordinate activities about the signs of depression and how to access 988 crisis lines. Next, we coordinated and promoted activities involving QPR, suicide prevention, or other promising suicide prevention practices. And then lastly, we distributed gun locks in our community. We have to submit quarterly reports on our CHIP progress. Next, we had to conduct and provide a yearly review of our structure and provide any changes that we made to that. Back in, I want to say it was April 2022 or 2023, we were formally recognized as the official health council of the county, so we were right on track with meeting that deliverable. And we also had to actively participate in at least one coordination meeting a quarter by reviewing the community health needs assessment and provide our feedback for those plans. So we have decided that we are going to be updating our fact sheet on a quarterly basis because we added a new section. It's titled Data Spotlight. So that's where we incorporate different data indicators that are relevant to our county. So that's, again, that's updated on a quarterly basis. And then presented to our county commissioners, like Denise was alluding to earlier. We did that back in January of this year just to share what our health council is all about and the things that we've been doing. So similar to this presentation here. We also meet with our health promotion team. So shout out to John and Maureen for meeting with us on a monthly basis because their assistance is greatly appreciated as they guide us in the right direction to achieve and accomplish this contract. And Rainey also conducted a root cause analysis, which we'll talk about here in the next slide. So we are right on track with meeting this deliverable here. All right, and then the last task was to attend regional health council gatherings and trainings, attend statewide annual health council gatherings, and then travel to conferences. We attend those regional gatherings. We attended the annual statewide health council meeting back in February, as well as Public Health Day at the Capitol, which was also in February of this year. All right, and then just some highlights we wanted to make note of for this contract. So some leadership from our health council trained 6 family medicine residents in harm reduction practices. In terms of community education, one of our contractors assisted Alamogordo Public Schools with their anti-vaping presentation. Some other members of our health council delivered an Our Words Matter presentation to this work group. We were also involved with QPR suicide prevention training, either through promotion or hosting/co-hosting sessions. We also are very involved in outreach and advocacy, so coordinated the DOH mobile unit for the January PIC count, promoted that PIC count countywide, and then again presented at the county commission meeting back in January. In terms of tobacco and mental health initiatives, our Health Council entered into an MOU with Constellation Consulting for new PAC continuation. We've done that the past couple of years. We also hired Rainey to carry out those tobacco cessation deliverables, and she completed a root cause analysis on mental health and nicotine use in our county. As far as community engagement and partnerships, we have distributed over 150 gun locks in the community this fiscal year, and we have an upcoming event next week. We are partnering with the Counseling Center, 100% Otero, and the Village of Tularosa to host a Narcan training. And then just some staffing and recognition. Again, we hired Rainey this past March. We're so happy to have added her to our team. I helped co-facilitate the statewide Health Council meeting and presented at Public Health Day. And Denise received a Behavioral Health Award for her contributions to that sector. All right, so now we're going to get into the CHIP plan, which you all should have a copy of. So we've spoken about the CHIP extensively for the past couple of years, but if this is your first time hearing about it, I'll just give a very quick rundown of what it was. So back in 2022, Health Council statewide started this process where they were identifying the top 2 or 3 community health priorities. So similar to other health councils, our health council went through prioritization process, data collecting process. So we administered a survey to various stakeholders to gather input on their views of what are the top priorities in our county. And so after several work sessions, we have identified this right here as the top health priority. Originally, we identified 3, but we decided to consolidate it into this long sentence. So our priority is mental health, and that includes substance use, crisis response, access to care, and suicide prevention, with a focus on drivers of health / access issues of housing / homelessness and transportation. So the populations that we decided to prioritize include individuals or families that are dealing with mental health and or substance-related crises, people who are unhoused or are experiencing housing insecurity, those who fall into that gap who need support but don't qualify, people who are reintegrating after incarceration, and finally, people with a lack of dedicated transportation or with barriers to access of basic needs. We came up with 4 short-term goals. So we wanted to play a key role in initiatives that focused on improving our community's continuum of care that support people that live with mental illness and or substance use disorders. We also wanted to participate in community outreach events that focus on raising awareness of and increasing access to existing resources. Next, we aim to develop an issue brief that highlights local housing and transportation needs and potential policy solutions. And then lastly, provide nonpartisan civic health training to organizations. So here are some examples of our progress since we've started implementation of this action plan. So goal number 1, here's just a list of a couple of initiatives that we have played a role in, whether that's being part of the planning committee, promotion, or providing technical assistance. Goal number 2, here's just examples of different outreach events that we've attended, again, to raise awareness of existing services and resources. The third goal, which is the issue brief, the Health Council identified the HEAT team to be the group to lead this goal. So we've been taking point on that. We've hosted 2 focus group sessions. Now we are back to reviewing the input that we gathered from those focus groups and identified other groups or entities to approach and tailor questions for those groups. So after all of that is done, we'll then transition into doing the same process for transportation advocacy groups. And lastly, for short-term goal progress, here's just examples of how we have tried to promote civic engagement and educate others on that connection between voting and our health. All right, for long-term goals, we aim to conduct a housing and transportation equity assessment and share it with our community leaders, partners, and decision makers by the end of 2027. And in that same year, we hope to increase past year civic participation amongst our health council members compared to our 2024 baseline, because we administered a survey last year to our health council members. All right, so not much to report on our long-term goal progress because they're contingent on the completion of our short-term goals. All right, so upcoming projects. So the three big ones, we will continue to update and revise our CHIP action plan. It is a dynamic document, so it's ever changing, ever evolving. And hopefully after we get feedback from all of you, we can incorporate that into that document. And because the fiscal year is quickly approaching us, we will be shifting our focus to what both contracts from DOH and LC12 contain and adjust accordingly. And to make note that the DOH contract for this upcoming fiscal year has a pretty heavy emphasis on behavioral health. So we'll be a bit more active in that sector. All right. So as a health council, we are entering a strategic planning and restructuring phase. Your input today and going forward is essential to that process. So our conversation today will help us identify what's working, where alignment exists, and how our health council can better support collaboration and impact across our community. And this is just one of many conversations that we'll have, because your feedback is going to guide the creation and evolution of our action team so that we can be responsive to community needs. And it's going to provide a broader direction for us moving forward. All right, so now we're going to shift into the large group activity. I'm going to stop sharing. Are there any questions or comments before we move into that?
I was just gonna comment, Kayla, you didn't give yourself enough credit. I think Kayla is also some of the things that weren't recognized on there is she was very instrumental in helping to facilitate our community collaborative forum discussion. I don't know if some of you have participated in that, but that's also an attempt to a lot of duplication at times, right? Unintentional duplication, sometimes it's funding based, right? So there's an initiative led by the New Mexico Alliance of Health Councils, Early Childhood Education, the Healthcare Authority, to convene into the Community Collaborative Forum discussion. And Kayla has been instrumental in helping to facilitate those kinds of things and always has her hands in a lot of things. So that's something that I think also should be recognized by the Otero County Health Council. So thanks, Kayla.
Thank you, John. Any other questions or comments?
This is Lisa. I just wanted to thank everyone for coming and to explain that what we're looking at next is to really understand what each partner is doing in the community so that we're not competing with one another, but instead collaborating together. We want to know how to help you, where are there gaps in care and services, so we can all try to work together. So please share as much honest feedback as you feel comfortable to do so, because it will help all of us, I think. Thank you, Kayla.
Thank you, Lisa. And there is a post-meeting survey So we strongly encourage all of you to complete that, because in that survey, we ask questions about gaps in services, how our health council can support you, and we will be reviewing that, and we will be incorporating all of your feedback into our strategic planning. So please, please, please complete that. Because today we're going to be focusing on strengths. You know, what's working well, what you guys are doing, where there's alignment, and where there's room for opportunity and collaboration. Okay. All right. So I'm going to share my screen again, and we're going to move into so we have an organizational spotlight and alignment. So we are asking for each organization to share, and we'll add notes to the shared space, and then we'll send it out to everybody. So everybody has information about what each other is doing and how we align with one another. And feel free to expand on your responses after the meeting. And if you go over here to the tabs, we have an additional document. This is just additional feedback, more space, a parking lot, if you will, if you want to add more. But we are kindly asking you to identify your name and affiliation with your note. All right. So who would like to go first? Unless you'd like for me to be the teacher and just call on people, but I hate doing that. I hate doing it, but I'll do it. But just share a key focus area or program, and then strengths, alignment, and collaboration opportunities.
I have something to share. Hey, so again, I'm Tanya. I am with Golden Hearts Home Care and Diagnostics. Our priority area is mainly the elderly, of course, and the disabled. We do not work with children, but we do a lot of like transportation needs and companionship needs, which really helps with the mental health of the elderly and disabled, because some people just need somebody next to them. I do have a collaboration opportunity coming up in August. We are planning a summer barbecue and health fair event, and I'm in the process of making vendor applications and invitations to come out and just interact with the community with a fun little raffle. We're planning bouncy houses and giving out hot dogs. And so I am in the process of making the flyers for that and everything. So I just wanted to share that.
Awesome. Now, do you see any alignment with what you guys are doing with what our health council is doing?
I do, because it sounds like you are really supporting mental health and growth in health awareness in the community. And so that is something we also are prioritizing too, because we know that there are a lot of elderly people who are not seeking, some of these resources that the community offers in terms of improving their own mental health, and maybe they might not recognize it, so somebody needs to like be there to help them along in that path.
Thank you so much.
Yes.
All right, Joanne, I see your hand raised.
Can you hear me?
I can.
Okay. Along the lines with the elderly, Otero County LULAC, we've moved our projects to Tularosa mainly because we get more volunteer help. And so anyway, we've started helping, started a volunteer group called Gente por los Señores. And it's, anyway, it's volunteers for the seniors anyway. And we found that the senior apartments here in Tularosa, they don't get a lot and a lot of help. And so we are gathering food from the food bank and taking it to the people that have no cars or transportation. And I found that they need a lot of care coordination. I've been working with this veteran. He's 80 some years old, and he kind of slips through the cracks in that he doesn't get full Medicaid. He has Medicare and he doesn't get full VA benefits, but yet he's a veteran that was affected by hepatitis C through injections when he was 17 years old and was discharged from the Navy, and he served in Vietnam. And the sad part is this man needs a lot of help because he got a liver transplant about maybe 3 or 4 years ago, but no one's following up his care to keep the liver. He also has and the reason I know all this, I used to be a care coordinator for Molina and United. So I just can't do it anymore. I'm retired and I'm a cancer survivor myself. So anyway, I don't know what to do about people like him, but I stayed on. I bet I've been on the phone 16 hours with his um, supposed social worker in the VA, the clinic with the VA in Alamogordo, and on and on. And he was granted from 21 care coordination or caregiver hours to 23, and yet Amber Care, I'm not blaming Amber Care, but Amber Care still hasn't gotten the okay to start services, and their sales department are not as pushy as I am. And I said, you need to call back the VA social worker. So anyway, if he's falling through the cracks, you know there's more than that. And from me talking to the people in the apartments, they're going in next January. They're going to have to move out for 30 days. There are no apartments here. There is nowhere to put them for 30 days, and they have about 5 buildings. So this is going to be a crisis. And the manager has no idea what to do. And he doesn't even know, the manager or owner of these apartments has no idea how to coordinate the help for these people.
Right.
So anyway, so we're doing what we can with the little few volunteers, and we could use more volunteers.
Ma'am, and this is Denise Flores, and I know I'm EF&P coordinator, however, a veteran myself. Have you reached out to Mr. Dave Henley, who's our veteran service officer?
No. If you want to, Kayla could get a hold of me if you want to send me that information, please.
Will do, and then possibly connect you with there's a veteran house over in TRC. I don't know if that would possibly be able to transfer.
Oh,
him
he
over
won't go. He's very
No?
stubborn. He
Okay.
wants to live. He has a dog and 2 cats, and there's just no way in hell. I know that maybe next year they're going to try to get him to go to Artesia because there's supposedly maybe like a, what is it called? Assisted living, but I'm not sure they'll take the animals either. And I can't blame him. That's his only family. He has no other family. And it happens a lot with seniors.
But if I could just provide that information, maybe Mr. Henley knows some other ways or outlets here for the state.
Yeah, if they could just get him a care coordinator and not a caregiver. I mean, he can get that. He needs a care coordinator. He doesn't know how to navigate the medical system. A lot of them don't.
Yeah. Well, there will be, so after we finish this, we'll have that 10-minute break where we can have informal networking. So that'd be a great time to share contact information or talk about this more in depth also.
Thank you.
Thank you. Thank you, Denise. Thank you, Joanne. All right. Any Okay, who's next?
This is Maureen, just kind of as a follow-up to what Joanne said, but also a resource that I've heard about vaguely, but not more information about, is that Sacramento Mountains, I believe, has a nurse on staff who is a care coordinator or navigator type position. I know that got mentioned at some of them we were all at, I'm gonna say 2 months ago, and then I didn't hear follow-up, but it might be great to connect with them and just see how does one utilize that service or get referred to that. I don't know if anybody else here knows more about it, but I think that'd be a great thing to investigate. And then I know that there's the Community Connections group through Christus as well that do some of that care navigation. I think similar to what Joanne was saying, it does have that. That's a pretty complicated situation. I hear what you're saying, Joanne, but I do think in general, all of us in our work come across people who need some type of care coordination, navigation, as Joanne was saying, and we just need to be more aware of how to connect people to those. So maybe that could be an opportunity to kind of build that knowledge and almost resource listing, but make sure that we're all familiar with how to help somebody with those connections. Does that help? And I don't know if somebody wants to speak to the Sacramento Mountains thing, or maybe we need to find out more about it, but.
I was gonna say, I mean, to both of these first two examples, Kayla, I think they're both kind of alignment with the Health Council and the State Health Improvement Plan, for that matter, is access to care. And the need for better actionable care coordination and navigation. And I know the state is working on it. We're gonna learn more about it this year. Lisa, you may have had some conversations at Christus, but the closed loop referral system that's coming. So I think these are all excellent opportunities.
Definitely.
This is Lisa Yale. Are we ready to go on to another organization, or do we want to stay with this?
Nope, we're ready.
Okay, thank you. I didn't want to stop the conversation. I'm with 100% Otero, and I'm so glad to see that we're partnering with so many of the agencies here today. We want to work together with all of you and, again, not compete, but collaborate. Our mission is to eliminate childhood trauma by helping families help children, but we don't turn away anybody because of their age or anything else. But I do want to mention a couple of upcoming things that we are working on. One is we're looking to create a position for a housing champion to kind of take all the different initiatives, all the different needs in our county, and be able to take some action on this. We are putting together some funding for that right now. Stay tuned. The next thing I wanted to mention is our Family Resource Center. We have a good chance of getting funding for the Family Resource Center. And the intention is to provide a one-stop shop for people and to provide them during hours that may facilitate access after a 9-to-5 job or 8-to-5 job, involving navigators to help get the resources to the people who need it. And the last thing I wanted to mention is that we have funding in hand to start a microloan program. And the idea there is we're going to start with people who don't have the funding to give their deposit or their utility hookup fees, for people who have been waiting for a year and a half to get to public housing. So we want to have a loan available to those people who have a steady income. Doesn't mean they have to have a great income, that there will be interest, but it'll be very low. And then we want to expand it to things like, if somebody needs transportation for their work and their car breaks down, they don't have the money to repair. We want to have microloans for those people as well. So you can kind of see where we're headed with this, and we're very excited. If you have any input or want to help us with these activities, just let us know. Thank you.
Hey, Lisa, can you repeat your first announcement?
The housing champion.
Housing champion, okay.
Is that enough information for you?
Yeah, it is.
And Kayla, I can kind of go next if we're ready.
I'm ready.
So I'm Christine. I'm with the Otero County Early Childhood Coalition. My fiscal agent is 100% Otero. We serve families with children birth to 5. And just wrapping up our first full year, we've done family dialogue circles all throughout Otero County. So started at home and Air Force Base back in December, and then Chaparral, Mescalero, Tularosa, Alamogordo, and really heard from parents and caregivers. And one of their biggest feedback was more family-friendly activities in our county, and also safe places. And so we are actually just diving into our strategic plan process. We started on Monday, but I think those are probably going to be our 2 action goals for the next year. And so I think there are lots of ways that we can partner, especially on the safer community piece of it. And then just from a family-friendly activity standpoint, we know that there's lots of things happening in the community, but how do we distribute that information? And so we created a kids calendar on our 100% Otero website. Just launched it maybe 2 months ago and now have promotional items. But we are hoping that that can also serve as a one-stop shop for families to find out what is happening all throughout the county. We've already got some good feedback about things that we can tweak on it. So I'm in the process of working with our IT director to do that. But we put like APS camps that were happening. There's a let us know button. So if you guys have an event that is coming up, please go on there and give us that information so we can help you guys publicize it too. And so that's kind of where we are.
And Christine said we, but it really needs Christine.
Well, and Christine, that's great. I was just gonna make a comment again. It's like a little aside, but with the website that was developed for Otero County Health Council, I had a chance to peek at it the other day. It's great. You know, wonder if there's a way, if you're talking to IT folks, there's a way to kind of cross pollinate.
Connect them.
So there's like kind of no wrong door, right? Because that's all about navigation, right? When there's 15 sites and if you happen to hit the wrong one or the right one, right? It's like.
And we're actually working with Diana County's Early Childhood Coalition. They loved our kids calendar and they're actually hoping that maybe they can tap into it. Since we cross cover Chaparral, so that we're not all having competing events on the same day. Because that's what we are finding out too. Mari was at our meeting on Monday, and we want to offer families things to do all throughout the year and not just 5 events that they have to choose from on one Saturday.
Yeah.
Would that be an opportunity for the Otero So for Otero or somebody that just have that hub to try to decrease the duplication, because that's a problem everywhere. I don't know quite the magic bullet for that one, but
We'd be happy to do something if we knew what to do.
yeah, I don't know. It's always a problem. Pre-diabetes, the person is.
We also have a regular calendar, not just kids' activities. This is Lisa again. And so we don't have any like reference points at the bottom, so interested in more information, go to this website or that one. That's something we might consider. I don't know if that's partially what you have in mind.
Oh, yeah.
But the calendar, is going to be having all of our meetings, all of your meetings, all of the events.
And a lot of virtual trainings. So I, being connected with ECCD, get a lot of information about state trainings that are happening, that are all virtual. Anyone across the state can access those. So we include those on the community calendar as well.
Do you want to mention the website?
Oh, so they're both housed on our 100nm.org website. And I have brought some kids' calendar postcards.
Thank you. Just want to do a quick time check. It is 10:55, and that's when we're supposed to have our break. Are we good to, I want to be respectful and mindful of everybody's time today. Is everybody okay with us continuing and finishing this part of the meeting before we move into a break?
Getting a lot of head nods here in the room, Taylor. That would be a yes.
Okay, cool. I see a thumbs up. Okay, cool. Right, thank you so much, Christine, for sharing.
Thanks, Taylor.
All right.
I'll go next.
Okay.
I'm Raquel again. So for our organization, you can put down Holloman Child and Youth Programs. And Teresa and I are from the CYP on base. So our focus area, priority area are going to be military kids, infant to 22 years of age. For me, it's those that are in school. For Teresa, it's in childcare. And
I'm sorry to interrupt. You said infant to 22, right?
yeah, infant to 22. So those that are in childcare or in school, or a combination of both. I would say strengths from being from the base, right? We have so on base we have something called the Community Action Team. We call it CAT. And so that's our on-base network. Denise Flores is a part of that. Our prevention office is a part of that. And so that's a resource that we could tap into that gets connected to all of the helping agencies on base. And we also have a very easy to access, I will say, volunteer network because we have so many young airmen that are always willing to support what's going on in town. So for alignment, we're part of the Early Childhood Education Coalition with Christine, and that has been very fruitful because we're able to connect with a lot that's happening in town, and also specific to the CHIP action plan. Along with CAT, one of those areas that we often talk about is mental health and support for our military members. Making sure that they have resources or information, referrals to what's available in the local community on top of what we have at Holloman. For collaboration opportunities on base, the Child and Youth Programs, we host a lot of, well, not a lot, probably a quarterly outreach event where we can have agencies come out and do like tablings to share information with our families. We'll have back to school will be our next time that we have a bunch of those going on. And Teresa, do you have anything else? You summed it up well. Okay, thank you.
Awesome, thank you.
If you don't mind, I'll follow Miss Raquel if that's okay. Denise Flores from the Exceptional Family Member Program here at Holloman, and I'm on the family support side. We're set up in 3 different components, and I'm, as our medical component calls us, we're the warm and fuzzies, right? We're here to help out with our families that support PC. They're traveling here to New Mexico, never been in New Mexico. How long are they staying here? Are there resources here? How are they adjusting to the community? So the priority area for us is going to be any dependent that qualifies for the EFMP program. And that can again be the age of 3 all the way up to, your spouse, right? To, into the probably 50s or 60s before they retire there, maybe there. Our strength is that we connect a lot with our 3 components to help out with that support of adjusting to the new location, ensuring that the assignment meets the medical needs that's needed. And then we also look for having activities. So we do have EFMP Connect activities. We do a lot with Miss Raquel and Miss Wiley as of ensuring that there's support for our spouses to attend activities or to go to their appointments there. And then the alignment with Otero County would be the idea that if for some reason the base isn't offering a service, say it's a support group for like postpartum or a NAMI type of support, mental health type of thing, that we have additional resources to make that comfort there. Because sometimes I've seen spouses, they want to, they may not feel comfortable at this one area, but they want another option possibly if capable, right? There, so just the alignment of utilizing resources and teaming up, I feel like there is a lot of duplicate. And I want to network into the community because our shifting of we were family readiness, now we're shifting to military readiness in the sense of we need to make sure our warfighter is prepared to go downrange or wherever location they go to, but our family is back here being sustained with support in the local community and base support, right? And that's where that networking with you guys, collaborating with you guys, like the United for Autism event, we helped marketed that there. I have to say, I think personally I could have done a lot more there as of have a table, but just the timeline, if I know dates ahead of time, we will collaborate with you guys to network and get our resources out and help our families here.
Thank you so much.
You're welcome.
If you want, I can go next.
Sounds good.
Did you say yes?
Yes, ma'am.
Oh, okay, thank you. I work for the UNM Cancer Center here in Albuquerque, New Mexico, with the Community Outreach and Engagement Office. So we actually work to make services for cancer prevention, screening, treatment, and survivorship more accessible to everyone in our state. I mostly work with the Hispanic community, Hispanic speaking community, and we do a lot of education, and also we go to different communities around New Mexico with a table. We do a lot of tabling events, and I take en español also educational material and resources. I'm a breast cancer survivor myself, and when I was going through cancer, I went through a lot of barriers that it was very hard for me to jump those because I didn't have access. I didn't know the system. I have a language barrier. I have my cultural belief, and also fear and all of that. So we actually work really hard with these communities to let them know how important it is to get screened for any type of cancer. We are seeing a lot of people coming with the cancer is already in the terminal and only have few months to live, and those cancers could have been prevented. So education, as you said in your goal, Kayla, is key. Prevention, but not only that, also resources. So we take resources also to this community. We speak their language and we connect them and let them know that if they do a screening and prevention, they can actually have, give me 1 second, my phone is ringing. They can have a better quality of life. So especially on this time right now, there are a lot of fear in the community. So we want just to go out there and say, you know what, do your screen and do what you have to do to be healthy for your family. We also have a patient navigation team here, which is great. It's also bilingual. So we can actually give them all that information. So if they don't want to talk to us right there, they can call to this line and there will be someone that can guide them and try to help them to find resources and also opportunity to get all those screens that they need. So yep, that's basically what we do. Thank you.
Thank you. And you might have already mentioned this, and if you did, I apologize, I didn't catch it. But what do you think about collaboration opportunities between UNM Cancer Center and the Health Council?
It would be great to know, for example, if you guys do like health fairs, we can actually go there with our material and resources, goodies for people. So we can do that type of collaboration as well. And also not only that, connect you also with other agencies in New Mexico. So to have more people like in this meeting right now to let us know what they do for the community. So networking also.
Thank you.
And thank you, Carmen and Gloria, and you may already be connected with the New Mexico Department of Health Comprehensive Cancer Program, but I do know they're going to start their new year of planning. And I can't read the title of their document. I'm so sorry, I can't read it right now, but I'd like to make sure to connect you with the doctor leading that program, and they are looking for community input from throughout New Mexico. And I think everything that you just shared, I think you'd be a fabulous participant in the advisory board for their planning. So if you're not already connected with them, if I may, I'd like to connect you all by email.
Fantastic.
Thank you.
All right, who is next?
I'll go, Karen.
Okay.
Counseling Center, and I won't bother going through the 16 contracts that we provide for the community, but I will focus on those that are we are championing and feel need the most attention within our county and community. So they all surround substance prevention, both on the youth side and overdose prevention on the adult side. So that's our priority in filling gaps. We've actually started the focus a couple of years ago, looking at our client sources, what data we're taking in terms of who we're treating and what we're treating, in terms of both the human service side of our services and the mental health side. What we found was obviously a major gap in our community for youth services and prevention for substance use. So that was our beginning journey. We just on May 5th submitted for a federal CDC drug-free coalition for youth for Otero County. We'll hold your breath and say a lot of prayers, and hopefully we may receive that. Even if that doesn't happen, the coalition still will exist. It just won't be funded until we find funding. However, the great thing is our county actually just yesterday voted yes to provide our match, which is through the opioid settlement funds. So that was a major component of this process. So we're working on that. We're working on, and I have a great crew working on overdose prevention for our New Mexico Department of Health contract, putting together trainings, getting out in the community, working with anybody and everybody in our community. The outreach I've been really, really pleased with in terms of hitting anything, anywhere and everyone, from Mescalero. We've done some major things in Mescalero, which has been an area where there's been a serious gap in working, but we've got a champion up there now, and so we're doing quite a bit there. And to going forward in the future. Part of what Chartel and Michelle have done is put together a fairly comprehensive resource guide specific to providers, both private and nonprofit providers who do substance use disorder counseling, and as well as put together a MAT providers list as well. We communicated with all of local private providers in order to let them know where they can refer clients, and providing them brochures so that they could have them on site to help individuals who are dealing with substance use disorder find resources both at the Department of Health. We have a MAT provider leasing space in our building, and so forth within our community. Lastly, we are excited about having a harm reduction mobile unit coming once a month to provide for individuals who often are not accessing services, doing able to receive the necessary tools and services that they need. And I'm speaking about largely our unhoused population. We are fortunate enough to have been part of a project funding for a couple of years ago for mobile outreach for that population. That population still shows up at our door, and we knew that would be the case. So we utilize a volunteer who does outreach, and our harm reduction, our overdose prevention and harm reduction staff to go out and bring them in. It's just started, but we're confident that it will build sufficiently. We've got some tricks up our sleeves and talked about how we can bring people into building. And so we're excited about that. I think the strengths are the counseling center has been in the community for 53 years and has long-standing partnerships and relationships with a large number of the community, which we support and they support us. And so I think that's a strength. I think the other strength is whether we have a contract or not, we typically will put our feet on the ground and find a way to help people when they walk through our doors, whether that is us directly and or referring them to where we feel that they'll be able to receive the services or supports, resources they need. And I think that resonates within our community very often. And I just am blessed to have great staff to be able to do that, whether it's part of their job or not. Aligning with the health council, the counseling center obviously works in, through, and with the health council. I think our overdose prevention, harm reduction, and mental health aspects, substance use disorder aspects will play a larger part going forward, and I'm looking forward to that. Collaborative. We try to be sitting at as many tables as possible, so we do collaborations. I'm trying to think if there's any upcoming that I can think of at this point, other than our, I think it's our next harm reduction mobile is always Monday, the third Monday of the month, from 1 to 5, and so we're bringing out the guns to try to amp that up and have people access them.
And then, Kim, sorry.
No, go ahead.
Adding just to what you're saying, I want to stop your train. No problem. But hi, everybody. This is Maureen online. The Chartel, I believe, is attending a harm reduction training out in Tuscaloosa
Oh, yes.
And supporting that, which had been set up prior to your contract, that she demonstrated was like.
She's doing an awesome job.
Yeah.
One of the things I'm happy to Chartel and Michelle did something that hasn't been done before in Escalero on that end. Into the Mountain Gods. Well, they had 90 employees of the Mountain Gods set up for Narcan training. And this first Narcan. That's the biggest thing that's happened up there in regards to prevention efforts. And they were just thrilled, and we got a lot of positive feedback. We will be working with other entities with at this level. So we're excited about that.
And that's just amazing. I just want to say, like, thank you to you and your staff and everybody. And I think, yeah, scratching and clawing and just going for any grant, right, that aligns. And I think looking at the chip and looking at next year's scope of work, which of course health councils will learn more about as we begin those conversations next on Monday. I just think somewhere to note or asterisk, I think that there's tremendous opportunity to further collaborate around mental health, substance use priorities. So I will tell you, MOUD, medication for opioid use disorder, treatment, behavioral health the state is putting a ton of money into those resources, right? But we can do everything downstream to treat, right? But we've got to get upstream to really get to the root causes, right? And I think the first step is understanding, right, who's doing what. We talked a lot about access and navigation, right? And some people will be comfortable with telehealth, others won't, right? But understanding who's doing what, there's an emphasis right now, incarcerated individuals coming out of detention facilities, making sure that they're getting treatment in detention if they come in addicted, but ensuring that they have that treatment and support outside of being incarcerated, so we're not just a revolving door, right? So no, I think this is that's excellent work. So thank you.
Awesome. Yeah, thank you so much, Kim, for sharing all of the amazing things that you and the Counseling Center is doing. All right, quick time check. It's 11:17. How many more people need to go? How many more people in the room need to go, or has everybody gone? I see 2 on screen.
Oh.
Okay, I got 3 on screen. How many in person? 1? Okay.
It's got a couple more, we do have a couple more. Kayla. Sorry, and I was just having a little technical. Okay.
All right, so, okay, 11:18. Let's do the 3 on screen and then move to in person. So, because I still want to give you guys a 10-minute break, but I definitely would like to get to our small group. I'm very interested in the answers you all come up with. So let's go to Jeanette, then Tyler, then Liz. Does that work? Yeah.
Hello. Do you guys need me to talk about mobile crisis at all, or are we good with that one?
I think it'd be great if you could talk about it in case there's people here on this call that don't know much about.
Sure. Okay, so the mobile crisis response team is a civilian-based team within the Alamogordo Police Department, and we respond out to mental health calls. We also receive referrals from, at this point, we've received referrals from Alamogordo Police, Tularosa Police Department, and the Otero County Sheriff's Office to follow up with people when they have crises to assist them with getting stabilized and resources in the community. So we have a 5-person team here, and we also work with pretty much everybody to complete the crisis intervention team training here at the police department. So lots and lots of community partners that are on screen and in the room today. So I am going to move on out of that hat, and I'm going to move into my private practice hat, because I think it's very important to list just a little bit to fill one of the gaps in the community. So private practice is positively, PAWSITVIELY, positively transformational health and wellness. One of the specific specializations for positively transformational is LGBTQ services for both adults and children. And we also have several groups included for those that are seeking out group therapy, whether it's DBT, mindfulness, or LGBTQ services. We also have a LADAC on staff to assist with other services. In addition, the animal control in Alamogordo has contracted to provide dog therapy in order to help keep dogs in homes, especially those who are being adopted out in Otero County. So those are being offered free of service through grants and through animal control through Alamogordo Animal Control.
All right, for both of those, are there any collaboration opportunities, Jeanette, that we should be aware of, or we can start looking into to support both of your roles?
I think if for mobile crisis, there's so many folks in here being part of our steering committee, our steering and stakeholder committee. That is always, we meet 4 times a year. That invitation is always open, and it gives you I lost the word, ownership over the program, because CIT is very much a community program. So we welcome our community partners to be part of that committee. And then also, when we do our CIT trainings, we love how many community partners. We have 20+ people come in for every training, and I'm just so thankful for that, because it really shows the ownership of the program to the community and the collaboration that we're all doing together. And then as far as for positively transformational health and wellness, just and part of, like Kim was saying earlier, knowing who you can refer to for specific services, I think that's really, really important in this aspect, and in all of this, like, who we go to for specific types of therapy in the community, etc.
Thank you, Jeanette. All right, Tyler, you're next.
Hello, everybody. So I am with Las Cruces Recovery Center, and our priority area is adults struggling with substance use disorder. Our strengths are that we offer support for people across the state of New Mexico, and we work with more of a cultural component to recovery, offering Mended Broken Hearts and Medicine Wheel and the 12 Steps. And what we do is a very individualized treatment program for each individual to make sure we address the needs of that specific person. In alignment with what we have going on here is, we have a huge substance use disorder problem in the state of New Mexico. And I think it's going to take, a great deal of a lot of us collaborating together in order to make a change. And I think the main collaboration opportunities we have are going to be to open up some sober living facilities, recovery houses, recovery cafes, that kind of stuff. And I think that it would be amazing to work with some of the local leaders in the community there in Otero County, but also all over our area to make sure that we can supply housing for the individuals who are getting the help that they need.
Thank you for that, Tyler. And I want to give a moment if anybody virtually or on or in the room would like to comment on the sober living facilities and recovery facilities, because that's something that we've been discussing in addition to like transitional housing during our housing focus group. So I want to make space for that if anybody wanted to comment or inquire more before we move on to Liz.
I'd just like to say, we know it's definitely needed. I'd like to have a conversation with this gentleman. We're always trying to find, housing for individuals who are dealing with substance use disorder. Really often they're individuals coming out of incarceration, and we don't have a whole lot of local resources for individuals, housing within our county. So I'd like some information. So Kayla, if you would definitely have that information in chat in the minutes.
Yeah, of course.
Thank you.
Absolutely.
And I was just gonna, I add to that is that this is a problem. This is not unique. I don't think that Otero County, I think it's really across the region. I'll just speak for the region. So I think again, something to consider. Again, I think when you look, have an opportunity or chance to digest next year's scope of work. Next year's scope of work is, I feel like a pity, but it's gonna have a lot of ties to Senate Bill 1, which is the funding bill for behavioral health. And then Senate Bill 3 talks about planning. And really the $4 million that was allocated to health council statewide really is tied to really what's been discussed, a lot of what's been discussed this morning, I guess is my comment that I wanted to make. And I think looking at taking, I think a lot of meetings, there's a lot of great discussions, and the first step is to convene and get together, right? But then now, how do we turn some of that to action? And what kind of action plans do you all as kind of organizations and as the Health Council want to kind of embark on, right? And so like Kayla had mentioned about the CHIP, and housing is a priority in the CHIP. It's a living, breathing document. So I think there's tremendous opportunity and synergy. So great. I'm glad I wasn't on Zoom today. I'm glad I came in person.
Awesome. Thank you. All right, Liz, you are up.
All right. So much like you all, Presbyterian Healthcare Services has been collaborating with Healthcare Authority, New Mexico Department of Health. We've been trying to minimize this duplicative effort. And we've been involved in a whole lot of spaces where we've connected with many different partners. And although we're very focused on, in my specific department, we're very focused on perinatal and child health, chronic disease prevention and management, social drivers of health, behavioral health, access and integration. I see that there's just a lot of opportunities for this growth. Like, for instance, we're in the midst of formulating a framework for a food as medicine program across southern New Mexico, and how that might look and where we, who we could partner with and how we can collaborate to bring this service and resource to these communities. That's just one of them. We've also been working with the community health workers and the whole process in reimbursement and trying to acquire more CHWs, bringing them together, walking them through the whole reimbursement process, and then there's always the closed loop referral system that we have integrated within our own organization. But then how are we going to bring it together as a community? So we have we just have a lot of networking and support that we can bring, and it just feels like a natural alignment with Otero County's Health Council's CHIP. It's just like a natural flow. So even just being in the room, being a fly on the wall has kind of helped. I know I've pulled resources together. I've made recommendations for networking and things like that. Just from my own work, that's not including other things. Like we now have a mobile health unit that we could probably schedule for one of the big events. Let's see. I'm trying to make sure I cover all of the points because for collaboration opportunities, we could, build and partner on CHW outreach efforts for high priority populations. Like this includes the youth, seniors, caregivers, everything that everyone has spoken about. Like we just need that infrastructure to kind of expand on it and build it out there. So even if it's just, a room full of people coming together, bringing those resources together, I think there's just a lot of potential. We can align food, housing, and mental health navigation services. We can do joint data sharing or learning collaboratives. I know we're also hosting a series of focus groups to identify pre and postnatal care. We just completed a series of maternal virtual care. And I mean, those tools are helping inform the programs that are developed to help sustain and promote the well-being in our communities. And if there's an identified focus and a need, then we can collaborate and resource on mapping that out. I know Blanca's there in person. Blanca, you're welcome to chime in if there's anything else that I missed and you want to share.
Cover the lower portion of the south of New Mexico. So I come from Taos all the way to Sierra County. I do a lot of networking events, all the health fairs, education material. I work a lot with Las Cruces Recovery Center, assigning MCOs to people, especially up in Mescalero, that need to be in the facility and can't because of Medicaid. They don't necessarily have to be Presbyterian. I meet with them. It can be Zoom team. I go to Las Cruces Recovery Center. I meet them halfway. I explain all the MCOs, and it's up to them to decide. I make that conversion so they can be admitted within 72 hours. So I know Tyler and Kendall working with Mescalero to cover those 72 hours, which is the process for them to be approved. In the meantime, they'll pay and then Medicaid will kick in. Like I said, it doesn't have to be press. So that's my work here in Otero. I work a lot with Chris, which is the mobile unit. I know Chris. Chris, we're going to be working with Golden Hearts for their event on August 2nd. And I'm looking for back to school events. I know that's something that we didn't talk about, but if anybody has a back to school event, I would love to.
Block party. Yeah, July 19th. No, it's never that Friday. In the 20.
Oh, you're right. She
went
went
to
to
25th or 27th, right, whatever that Friday is.
FYI, open up the Family Resource Center. Did you see there? Yeah. Next.
Yeah. And I want to do the same thing. I know Chris did it with TOH last year. So we're doing the same, but we can like to participate with us. I'm here.
We'll put you in touch with some people. Give you the dates.
Are you interested in doing what we call Days of Hope, which are resource fairs? They originally were focused totally on homeless. I think we're kind of also focusing on people on the edge, trying to keep people from becoming homeless.
So I do any outreach you want me to do. Something that we're starting with Las Cruces Recovery Center, we're just doing plain outreach. We're putting together lunchboxes, socks, every toothpaste, everything, and we're just going out in the street.
You're on our day of hope now. Okay.
Something that, you know,
Real quick, hold on. Sorry to interject. So the break, we can do some more networking, and I would love for you guys to do that. But another quick time check, it's 11:34. And even though I have the time to stay on a little bit longer, I want to be respectful of everybody. So how many more people in the room need to report out? I see one hand. Is it just one more? Okay. So after that, then we'll give you guys a break. Sound good? See some head nods? Okay. So go for it.
Presbyterian Medical Services, or PMS. I oversee several locations in Lincoln County and Ontario County, so we do primary care as well as behavioral health services. One of our strengths probably is that we are a federally qualified health center, so we do see everybody, anybody, regardless of their ability to pay. We right now our focus is our behavioral health service access. We do have a psychiatric mental health nurse practitioner actually in our office. For a long time, we did offer telehealth services for med management. So that's been fantastic for the community, navigating through that telehealth and in person. So that's really what we've got going on as far as collaboration opportunities. I am from Lincoln County. I live in Reynosa, so coming to these events and getting to know the community itself has been fantastic. Seeing what the actual needs of the community is. Oh, yes, and we have Carla over in Chaparral.
I'm sorry, did you say your nurse practitioner is on site?
Yes, the psychiatric mental health nurse practitioner is on site. Her name's Kinsey Earhart. She's fantastic, sees children and adults.
Any age children?
Preferably about age 5. Oh, because she'll sit it out depending on the situation.
Awesome. Thank you. All right. That was awesome. Thank you all so much for sharing. Okay, I just want to do a pulse check. Are you all okay to stay just a little bit past 12? No? I see a no from Carmen Gloria. I know. Yeah.
I think we've got yeses here in the room for most of us. Yep.
All right, so I'm gonna go ahead and give you the 10-minute break, but then I'm gonna cut down the time for the small activity so we can get out of here in a reasonable time, because it's Friday, okay?
Thanks, Kim.
All right, so I will see you guys at 11:47, but I want to give the floor to Lisa in the room, Lisa Yale, for a moment.
I have an announcement to make. There's somebody in this room that has finally learned the difference between Medicaid and Medicare because of the big birthday she's got on Sunday.
But I still haven't learned it.
I have some of her favorite cookies here.
I already ate one.
And nothing over there wrong was they are. So help yourself. Those of you that come to our house know that we have chocolate mints always available. So these have chocolate mints in the cookies from Rosie's Bakery. Thank you for letting me take the time.
I was so thrilled to see them.
Thank you. No, wait, there's more.
Oh, 47.
No,
Okay, everybody, it is 11:47. Can everybody in the room, physical room, hear me? I'm going to spotlight them so we can see them. Hey, April, do you mind unmuting? I muted you guys so we could converse online.
There you go.
Awesome, thank you. All right, so now we're going to move into small activity.
Well, we don't know. It's still on.
My screen.
We put in for, you know.
Okay, so for this small group activity, those in the room, you can group yourselves together at the tables, and then here on Zoom, I'm gonna break us off into breakout rooms. Okay. All right, so for the small group, I'm gonna need you guys to pick just one shared theme or issue from our large group activity. There was a lot of talk about mental health support, youth focus groups, and things like that, or resource navigation. So just choose one theme or issue from that activity. And then discuss, what are strengths, assets we already have in this area. You can pull from that chart. I'll put it on the screen, and then I'll drop the link in the chat for the virtual participants to refer back to that. And then second question is, what bold or creative idea could we pursue together as a collective, right? And then what's one practical step we could take in the next 3 to 6 months? And how could we make this effort sustainable or impactful? So I know that's a lot, and I'm only giving y'all 10 minutes because it'll be 12:59 and we'll still need a report. And I'm trying to get you out of here in a timely manner. But again, this is just one conversation. We are planning on having future sessions, so we don't have to have all the answers right now. We just want to start working towards making impact. So from discussing our strengths to actually applying strategy. Okay, does that work for everybody? I'm seeing some head nods in the room, some head nods on Zoom. All right. So let me go.
Doing that all together, Kayla, I'm so sorry, or did you want to put us on mute?
Sure.
Or
Yeah, if you guys, I can mute you, and if you guys want to just mute me, and then we just mute each other.
okay, and I will be a scribe for everybody so we can share ideas.
Well, so are we all one group, or is like each table a group, or what?
Table. Each table.
Each table.
And assign a note taker. And somebody will need to report out, and we're going to have about a minute each.
We gotta figure out what the topic we want.
So let me get some links in the chat for you guys here on Zoom. All right, so for everybody here on Zoom, I just dropped that link to that organizational map that we were working on. I'm going to put you guys into breakout rooms. I'm going to give you guys 10 minutes. I'm going to stay here in the main room to keep an eye on the in-person room. So.
Kayla? Can you hear? I'm sorry, I do need to get in here about like 5 after 12, because I have another urgent appointment I have to go to, so Is that gonna cause a problem with me being in one of the groups? Okay, thank you.
I have to just put you in a room that has 4 instead of 3.
Okay, okay.
All right, so you guys, ooh, hold on. Let me change that. Okay, it was set for 5, but just go back in. Hey, Joanne. Did you need something?
Sorry, I was muted. I need to leave the meeting.
Okay.
Okay, thank you for everything though.
Yeah, of course.
And I'll send the survey. Thank you.
Thank you. Thanks for coming.
All right.
Bye.
Bye-bye.
Welcome back, everyone.
Jeffrey, you know, with both of those, they're the only ones that like show up. So something really here. Something else. Which.
All right, let's go ahead and start with the room report outs, and then we'll finish off with us here.
So we want to say in 3 to 6 months, we'll try to get. And then sustainable.
And thank you guys, and then Caleb will call your people.
Okay. I suppose I will, since I'm taking notes. I should get over that.
All right, Maureen, are you reporting for each group in the room?
Actually, just for one table, we ended up like 3 separate tables, and yeah, so I'll go first if that's okay with everybody. So at our table, we had Kim, Christine, and Blanca, and myself as note taker. And so what we chose to talk about were the local strengths in mental health and substance use treatments. Can y'all hear me okay? It's good, okay, thank you. And it was shared that we have some providers in the community, we do have providers in the community, which is an improvement over years past, so that's awesome. We have a lot of community members that are interested and invested in those type of treatments and needing treatment and supporting treatment. And then we have hospital inpatient and outpatient behavioral medicine located here in Alamogordo, so for Otero County and the surrounding area, which is great. And then there has been an increase in medication assisted treatment or MOUD providers and provisions. And so we were able to identify at least 4 here in Otero County. And I believe through PMS, there's one in, is that correct? I'm sorry. Oh, sorry. And you all have MAT at your video swaps. Or so we just talked a little bit about that, and the counseling center has a listing on that they will share out. And then, we talked about, so there are just some connections made at our table, which is great for like resources and referrals and sharing information. And then we identified, the counseling center as a, which Kim herself abstained from saying, but I would like the counseling center as a great resource, and we all agreed. And they allow crisis walk-ins. They provide pretty quick access and turnaround for new clients seeking appointments. So they really at the outside are like 14 days, which is just tremendous in that arena. I'm sure most of you all know that. And what else? We talked about the opportunities for collaboration with the Early Childhood Coalition. And they're working on their strategic plan. That group is working on strategic planning. And so we were just talking about there's opportunities to collaborate on distributing medication safety boxes and through the Up and Away program that the counseling center should soon be part of being able to offer. Presbyterian offered hygiene kits for any of our outreach events and agreed to participate in several of the upcoming outreach events. And Blanca is a Medicaid eligibility specialist who can also help people apply for SNAP and LIHEAP funds. I feel like we got to a lot of things. I'm not taking too long, sorry. And then the counseling center also currently already has a nurse practitioner on site who can see and prescribe for adults for mental health medications. And also soon we'll have a person who is a specialist for children and will primarily see children for that same issue. So lots of good things coming up. Team, did I miss anything? Thank you.
Thank you all. All right, who's next?
I'll go. I'm Peg, and I was with Raquel and John. And we kind of talked about what the base needs because they're kind of a unique situation there. Population, yeah, thank you. So, and we talked about all those things, all the things we talked about, housing, access to care, mental health, substance, whatever. Those are all things they need on the base too. So we kind of focused on access to care because sometimes families come here from places that have a lot more services than what we have in Otero County. And sometimes people can't come here because we don't have the services they need and stuff. So we were talking about getting services. So we said one of the strengths is things like this, the outreaching and networking opportunities within the community. So every time we do something like this, we find a new connection that we need to make or something. And that's what we talked about, is that one of the things is they have a CAT team, a community action team, and they want to know about all the services and they still don't have all the services they need. So we talked about having the CAT team come to a health council meeting, come to a 100% Otero meeting to talk about what the CAT team is. And then all the people that are on those meetings can say, oh, I can help you with this and I can help you with that and make some of those connections. So that's kind of our short-term thing in the next 3 to 6 months is Raquel's going to connect the CAT team with both the health council and 100%. And then we didn't talk about making it sustainable long time because we were too busy talking about other stuff.
Okay, like that.
Okay, I would be next. My name is Therese and I was with Lisa, Leticia, and Candace. And our shared theme was awareness. We feel like our county does offer a lot of services. The challenge is the people that need to know about them, knowing about them. So we thought for our bold and creative idea, having some kind of partnership with the Otero County Fair, where we have some kind of table or booth there. We figured that would be a great way to have outreach because everybody in the county comes to the fair. Our biggest challenge would be how to get people to come to the table or to the booth because there's a lot of distractions at the fair. So we would want to have some kind of ringer or hook to draw people in and kind of keep their attention long enough for them to get the resources. We talked about having like a huge teddy bear because that would draw people to come to the fair, or a large dinosaur or something that would get people's attention to come see We talked about doing kind of a do you know kind of event, so we're asking questions rather than just giving them handouts. At the very end of our conversation, we posed the idea of a Jeopardy game where we have a Jeopardy game board and people can select, like they want mental health for 200, and then we can have these games and ask the question or give the statement and have them ask the questions back. So that was we barely got to touch on that because that was at the very end. One practical step again is to have that presence at the county fair, and then to be sustainable or impactful, work on attending the county fair every year, but beyond that, other community events that go on. Whenever there's an event at the zoo or 100% Otero or Otero Early Child Care Coalition, having a presence there so that we're still getting that outreach done whenever the community has an event that they're coming together.
And we can take it to other events too.
Yes.
Yeah, oh, you said that, I'm sorry. No. Thank you, nice job.
This is Lisa. I want to report next because it's similar in some ways. My group was Carmen Gloria and Denise Williams, and what we talked about was the lack of care navigators and how that seems to be a critical across the board issue. We talked about the importance of community health workers being able to serve as those care navigators in some places because they're actually out there in the community, they're members of the community, and they're interfacing with our clients and people with needs all the time. So our suggestion was for our bold and creative event was to host a meeting with all the community health workers in Otero County and share with them the results from today about what resources are out there, what initiatives are there, and educate them to be able to empower them to work as care navigators on our behalf. So that was our suggestion.
Thank you. Thank you, both groups that just reported out. And I have to add, if you're going to be hosting a Jeopardy game, I'm definitely there. Okay, that's an excellent hook. I love Jeopardy. Okay. All right, who wants to go next on Zoom?
I'll go next. This is Jeanette. My other Zoom members left me alone in the Zoom meeting after we talked in the breakout room. So one of the things that we talked about specifically, Joanne Bulow was in my group, is getting resources out to Tularosa. She was saying in that survey that they did over there that one of the things that the youth identified is having cookouts in the park or something like that. I recommended to her that she hook up with the care team to do something like that. So have some type of an event in the park for the kids, for their families, cooking out. But we could get together to do something like that. But overall, she said we need more events in Thule.
Thank you, Jeanette. Anybody else? Any other reports?
Oh, yeah, sorry, one more on that. In that survey, the kids also identified wanting some type of a recovery house or substance use program for adults. They said it's, specifically the people who are in the park that need help.
Interesting, yeah. Rainey, I saw that you unmuted.
Yep, so my group, only Tanya and I are left. It was Tracy, Tanya, and Tyler. And we kind of went pretty big. Our shared theme was like the advertising, the getting our community actually aware of us. And we one of the ideas that was thrown out was infiltrating and getting all of our community chamber of commerce involved, getting in there, letting them know who we are, what we are, our needs, see if we can get financial funding, support, advertisement, just anything we could do through the local chamber of commerce, see how we can get involved in their stuff to have our voices heard. So it's kind of more of that broader type of idea.
So a lot of emphasis on awareness, raising awareness of who we are and what we can offer our community.
Yep.
Awesome. All right, it is 12:15, so let me run through closing remarks so we can get out of here. And I don't have much to say. Just a huge thank you to all of you for joining us, for participating, for educating us on what you are doing and how we can help you. We look forward to continuing this conversation and really making an impact in our community. So I'm going to plug in the survey again. So please take the time to complete it, because we will be incorporating everything that was said today and everything that you include in the survey into our strategic plan. All right, and if you guys need anything ever at all, feel free to contact us and visit our website.
Hey, Kayla, can I just jump in for a moment? If I can just encourage everyone, when you fill out the post survey, I mean, this meeting, at least from my perspective, seemed like it was really valuable. I'd be interested to know if any of you think that we should hold these quarterly or even twice a year, just to continually update all of us, each other, on what we're all doing together. So if you would comment on that on the post survey, I'd really appreciate it. Thank you. Thank you, everyone.
Thanks, everybody. All right, I'm going to go ahead and cut the call. And have a great birthday, Peg.
Thank you. Please, you get to get back to your vacation now.
Yes.
And the babies, all these wonderful people joining us on vacation. Oh my gosh.
Well, have a great vacation. Oh, she zipped out, which is good.